Their motto has always been compassionate for people. And I don't know what the word means, but I think it means we care for the people. That's what Aspirus has always said, so I just want that to come back.
Norman Pesca's son, Dan Pesca, lives with cerebral palsy. Norman says without the Ontonagon Hospital there to stabilize Dan during an emergency, life-saving treatment could be a nearly 3-hour drive or emergency helicopter flight.
We never had to take a helicopter yet because you get stabilized here and away we go. Well, if you couldn't get stabilized here in the future, however it goes, if you couldn't get stabilized here, we got to rush into Wausau. And that could be an issue.
Pesca is far from the only one in the county who has relied on the Ontonagon Hospital in a life-or-death situation.
My sister ended up in a bad accident this winter, and if she didn't have the emergency room here to stabilize her, she would have never made it. They had to airlift her to Duluth, Minnesota.
In September 2021, Aspirus Healthcare announced plans to construct a nearly $16 million modern facility to replace the current hospital, which is out of code and grandfathered into the system. Now, just more than 2 years later on Saturday, Aspirus plans to end the hospital services with no plans to replace it.
What happened in the last 3 years to change their mind? I have no idea. Whether they looked at the financial impact, we really have no idea as to what changed their mind on that.
Mike Coker, the Ontonagon County Emergency Manager and 911 Director, says Aspirus's announcement on February 20th to close the hospital came as a shock.
And we were being told the hospital would be closing in 60 days. That was the first notice of anything occurring. Of such a significant impact to the county.
Coker says he thinks Aspirus wants to close the hospital because it is losing money, but the healthcare provider has not confirmed its reason.
Based on some of the number indications that Aspirus administration gave us, it was a losing proposition. That's why they wanted to convert the hospital into a rural clinic.
In its February press release, Aspirus said, currently, Aspirus Ontonagon Hospital serves just one inpatient a day on average. Some days, there are no inpatients. Coker says he does not dispute Aspirus's claim, but he does say, on average, there have been a low number of inpatients for many years, including when Aspirus announced its plan to expand the Ontonagon Hospital in 2021.
But that's been that way for 19, 20 years. Something along the way had to have happened that they decided it wasn't worth their money investment to keep an ER and a hospital open.
On top of those who live in the county, Coker says the hospital's closure could deter tourists from visiting the area.
Not having an ER within proximity of the Porcupine Mountains Park and all the other tourism that happens up here, people come to our area expecting that we will have some sort of emergency. We will have none.
Aspirus says it will keep a rural health clinic where the hospital used to be. While it will not offer emergency services, Aspirus says its services will include retail pharmacy, physical, occupational, and speech therapy, specialty outreach for cardiology, women's health, podiatry, and diabetes. Coker says those services will be beneficial, but will not include necessary life-saving treatment.
It'd still be a clinic. The clinic will have some enhanced services, but what worries us as far as county officials is the fact that after 5 o'clock at night, anything that happens, you're taking an hour ride to the next county. That could be something as simple as a simple cut that needs stitches. That won't be done in a clinic.
Aspirus said to TV6 in March that it will not comment on its decision any further than it did in its February press release. Coker says for more than a month after Aspirus announced it would close the hospital, it did not respond to Ontonagon County's multiple requests for comment. He adds Aspirus finally responded less than 2 weeks ago, saying it did not see a way to keep the hospital.
That was not successful until we had Congressman Bergman assist us in making that meeting happen. They felt it would not fit in this particular scenario, and that was the end of what we received from them.
Sonco Ambulance Company is supported by a millage in Ontonagon County. Coker says it and Aspirus Medevac services will remain open and continue to respond to emergency medical calls when you dial 911. But after the hospital closes, both will no longer be able to transport patients to Ontonagon. Instead, EMS workers will have to drive patients about an hour to either the Baraga County Memorial Hospital in Lance, UP Health System Portage in Hancock, or Aspirus Ironwood Hospital. Coker says this will turn a roughly 30-minute round trip for ambulance workers into a much longer trip.
We're looking at a minimum of a 3 to 4 hour turnaround for our ambulance company. We have no idea what that's going to look like in the wintertime.
Coker says there is a positive note to end on for most of the hospital's employees.
The majority, up to 70-75% of the employees, were able to find other positions within Aspirus. That's been fantastic.
We are disheartened by what is going on here.
Patty Aho is one of at least 10 employees at Sonco Ambulance. After Saturday, Aho will have to bring patients to a hospital out of the county if they are in need of emergency medical care. She says Aspirus's decision to close the hospital will be devastating and could force many to move out of the county, which is already losing residents.
We have people speaking that they're going to have to move out because they have very sick children. They will not be able to stay in our area. I am just so afraid that nobody will be here. They'll end up closing the schools. There will be nothing left to this town.
Aho isn't the only one who thinks people will flee the area once the hospital closes.
We had one young couple come up to me and personally said that they got to move because they have a young child that has, a critical illness and needs emergency services. And actually that day they were bringing them to the ER up there that day, and that was just last weekend.
This is yet another reason a group of federal, state, and local leaders is working to find solutions.
Ontonagon County would be the only area in Michigan without emergency care, and we just can't let that happen.
The lack of a hospital in Ontonagon will create a medical care desert in the county. This means residents will have inadequate access to emergency care with a roughly 60-minute ambulance ride to one of these 3 hospitals. State Representative Greg Markkanen, Congressman Jack Bergman, Senators Gary Peters and Debbie Stabenow, State Senator Ed McBroom, and Ontonagon County leaders have united to find a way to maintain the hospital's emergency services. Representative Markkanen says the group is still petitioning Aspirus and that there is a way to keep the hospital if Aspirus chooses to pursue it.
The Rural Emergency Hospital designation is a federal package that would fund critical care facility for rural areas just like Ontonagon, the village of Ontonagon.
According to Congressman Jack Bergman's office, an REH designation would give the Aspirus Ontonagon Hospital around $270,000 per month and better Medicare reimbursement. In exchange, the hospital would have to keep its 24-hour emergency department, observation beds for patients, and certain key health services.
We're working through Congressman Bergman's office, and Senator Stabenow and Senator Peters' office is supporting that effort to get that designation if Aspirus chooses to go that route.
Ontonagon County Emergency Manager and 911 Director Mike Coker says from what he has heard from Aspirus, he doubts the provider will opt for the REH designation.
After having sat down with the 3 top administrators for the UP hospitals, it was pretty clear that they looked at the REH designation, it didn't fit, and the doors are closing on the 20th of this month.
During this meeting, Coker says the county asked Aspirus if the hospital would be considered for sale after it closes. A rural health clinic owned by Aspirus will remain open at the hospital, but Coker's hope is that another entity could buy the hospital to continue the emergency services at some point in the future. He says right now there is a possibility of a buyer down the line, but there is currently no interest.
The answer that Aspirus administration gave was they have no offers on the table. We interpreted that as being possibly, but we obviously do not have anybody interested in buying a hospital.
Even when the hospital closes, the Ontonagon County Sheriff says you should still dial 911 for medical emergencies. To make up for the longer travel distance to an emergency room, he says the Sheriff's Office hopes to teach its deputies, corrections officers, and the county's volunteer firefighters medical first responder training.
Which is just under EMT, but at least when someone goes to the scene, one of my deputies, they'll have the gear and the knowledge to prep them, so when the ambulance comes, they'll be transported to the closest hospital.
The sheriff says he is not giving up hope on a possible solution to maintain a full-service hospital and emergency room.
Short term, it's very concerning, but we are working on solutions, so hopefully long term it doesn't affect us as much as the theory. It's concerning, obviously, but we don't know where we'll end up at the end.